Hi YouTube, I just wanted to do a follow-up on my partial thyroidectomy or thyroid lobectomy, whatever you want to call it. So the date today is the 19th of September, and I had my operation on the 5th of June, so it's been, 3.5 months since I've had my surgery, and I think I'm doing pretty well. I did a video sort of 2 days after surgery, and I just looked back at it. I think I was still pretty out of it, which is quite funny really, and I was also like really awfully blondie ginger. But yeah, so I just looked back to that video, and I don't think I covered off everything that I could have, but at the same time I think there's a lot of things I can update you on. So first of all, I suppose it's the scar. So I don't know if you can see it, but it's not that visible. And the only problem is it like grips a little bit when I swallow. Like I can't feel it, but when you see it, it kind of does that. But I'll move on to that later. So the scar, even from like a week after the operation, I got the bandage removed by a nurse, and she was so impressed with it. She was like, "You're not going to see that in like a year's time. You'll barely be able to see it." So yeah, that was good. There's a tiny little bit that was still open, like not open into my neck, obviously, but just like a little bit not quite come together. So I had to wait a while. She recommended I put bio oil on it, as did a lot of my friends, which I've kind of been doing. So I've been using this regen oil for stretch mark scars, dry skin, blemish skin. It's basically like a knockoff of, you can see because the light, a knockoff of bio oil. And I'm not 100% sure exactly how much this is. I think it was like £4 or £6 for this bottle, which is 75 millilitres, so it's quite a bit cheaper than bio oil, and I got that from Asda, but I think you can get knockoffs in like Superdrug and Boots and like everywhere like that, and it's essentially the same stuff. I don't know if it does that good. I think it just like moisturises it basically, but the main thing my surgeon told me to do at my follow-up was just to massage it, which feels really, really gross, but it is really important you do it because it stops your scar from sticking and will make it like go a lot quicker. So anyone else that's sort of had this operation, as soon as you can start massaging it, make sure you do, even if it feels gross. Like it makes me feel like I want to be sick, but you just have to do it. What else? So my operation was on the 5th of June. Looking back at it now, I think it went pretty well. I remember after the operation, I was in a bit of pain. I was in a bit of pain with my throat and my voice for about a week afterwards, but I think it was more due to the tube they put in your throat opposed to the actual like scar site. Like it was a little bit swollen the next day, but not massively. But more the pain in my throat, I think, was due to the tube in my throat opposed to the actual incision, and that I think was one of the worst aspects of it. When they brought me through after surgery, they take you to like a recovery room where you come around and the nurse sits with you and you stay there for like 20 minutes, half an hour until they're happy, and then you'll go back to your ward for a couple hours to recover. You had to eat something and drink something. They had to be happy that you can walk around and like go to the bathroom and stuff like that. So when I went back to the room and they brought me some toast out, I felt really, really sick. And what I didn't remember before, but they said they were going to give me an anti-sickness drug, and I think maybe they forgot to do that. So I had to ask for the anti-sickness drug, and then they gave it to me, and then I was fine. Like literally like 10 minutes afterwards, I felt fine, but I felt really quite nauseous, which is weird for me because I don't really get sick unless I'm like really, really quite drunk or really poorly, which doesn't really happen, so I don't really get sick that much. So that was weird. That was pretty nasty. In the car ride home, I felt a bit rough. The first couple of days, a bit of a blur to be honest. I just remember being like quite slow. I think it was after about sort of day 3 or 4, I started to pick up a bit. I started wanting to sort of, so I horse ride. I wanted to go up and see the horses and stuff like that. And yeah, I think I started to drive about sort of day 4 or 5 as well, which was nice to get my independence back. I know I went to a wedding reception 8 days afterwards. There were a lot of my work colleagues and stuff, and that was really nice. I wasn't in too much pain. I couldn't really like shout or like scream or whoop or anything like that because like it kind of pulled a bit. But I could talk to people and have a drink and have a laugh and all of that, so that was nice. So yeah, so I'd say about a week until you can get back into the swing of things. You just feel a bit slow for a while. I think it's the other half of the thyroid taking over, or maybe you're still getting over the anaesthetic, any of those things. When you have a thyroid removed or part thyroid removed in the UK, you're meant to have a 4-week follow-up, I ended up having an 8.5-week follow-up, but it was actually going to be a 12-week follow-up. From what I understand, my surgeon was on holiday, so it's not like his fault, like he's entitled to holiday the same as we are. But obviously I think maybe there were just like too many patients or follow-ups, or I don't know exactly what it was. So they wanted to make me wait 12 weeks, but I've just moved to Plymouth. So luckily I managed to tell them, you know, I'm moving house. I can't come all the way back home. It's about 250 miles away. So I was like, I can't come back just for a morning appointment if you're going to tell me everything's fine. So they moved it a bit nearer, and he just checked it and he said everything looks fine. It's healing up really quickly. I just need to remember to massage it because it's just a bit stuck. But I can touch it and like play with it a bit, and it's really not that bad. Most people, like we had some new people start at work when I was working back home, and after about like, maybe it was about a month after the operation, and they didn't even realise I'd had an operation until someone mentioned it to them. So the scar's really not that noticeable. Like I think it's more noticeable to me than it is to anybody else. So that was my biggest concern after the surgery, really, was that, and having to take medication. I haven't needed to take any other medication. At my follow-up appointment, I had a blood test. My surgeon said he'd write to me if I needed to take anything else, and I haven't had any other letters. So assuming I don't need to take anything else, it's all fine, which is, again, it's really, really good. If you can sort of keep half your thyroid, then it's worth it. It means you're not got to be on medication for the rest of your life. What else? I don't think I've had any symptoms. I haven't like gained any weight, anything like that. I think I have gained weight, but I think that's for other reasons, like eating too much. Like I've not gained weight like out of the blue or anything like that. So yeah, overall it's been not that bad. It's the first time I had surgery, and I'm probably like, if I had to, I wouldn't, I don't know, like you never opt to have surgery unless you want plastic surgery, but you'd never opt to have a surgery like that. But if I had to, like, I wouldn't really complain about it. It wasn't that bad. Yeah. But if you have any questions about getting the thyroid removed, or if you're really anxious about it like I was, then let me know. Ask as many questions as you want. I'll try and help out. The only thing that I've just remembered is that when I went for my follow-up, my surgeon told me that I had multiple benign nodules, but they would have carried on growing. So basically, it's good it came out, because they would have got to the point where they would have like not stopped me breathing, but caused me problems breathing, and I suppose ultimately stopped me breathing. So it was the right thing to take them out. So yeah, if you have any questions, like I said, or you're concerned about getting it, or just want someone to chat to you about it, let me know, and I'll try and do what I can to help. Thank you for watching.